I first wanted to define what autism spectrum disorder is. So, it is a neurodevelopmental disorder, and as we learned in class, it is characterized by difficulties with social skills, repetitive stereotyped behaviors, and they also have trouble with verbal and nonverbal communication. So, what might autism spectrum disorder look like? So, individuals with autism might repeat behaviors that might be a hand movement, a body movement, whatever that might be, they will repeat that behavior often. They often have trouble with eye contact, and they often have difficulty communicating socially. In social situations, they find the back and forth reciprocity of communications difficult most of the time. They have trouble picking up on social cues, so they might not be aware that they're in danger. They might have trouble understanding the emotion of others, and they might not be able to relate to the emotion of others because they're not able to pick up on that. They often have difficulty making friends, following directions. They might have difficulty picking up on sarcasm. So, when communicating with an individual with autism, it's important to be very direct and use concrete language and not use sarcasm, be very straightforward. And individuals with autism often have difficulty with change. So, for Autism Awareness Day, I shared a post on Facebook and it said, "The whole world is overwhelmed by a sudden change of routine. It's not that easy, huh?" So that goes to show our routines are changing. We're having to stay home and change how we do school, how we do work. And these are changes that are really hard for us. But to think about an individual with autism might have to experience changes in their routines maybe daily or weekly, and that's really hard for them. So we are kind of seeing how a change in our routine is hard for us. Imagine how it might be for an individual with autism. To screen for autism in individuals, ASHA highlights the characteristics that set autism apart from other developmental disorders. So, individuals with autism might have challenges with eye gaze, orienting to one's name, pointing to or showing interest, with pretend play, imitation, nonverbal communication, and language development. So, all of these are what set autism apart from other developmental disorders. And they can help in screening individuals who might be at risk of having autism. At the beginning of the semester, we discussed the MCHAT in relation to screening individuals with autism. So the MCHAT is the modified checklist for autism in toddlers. It consists of 20 questions that are in relation to, it in quotes, your child. So a parent would respond yes or no to these 20 questions. And this screening tool is intended for children of 16 to 30 months of age. And after calculating the results from the answers of the MCHAT, the screening tool can indicate whether a child is at low risk, medium risk, or high risk of having autism. So it's important to note that if your child is indicated of having a low risk of autism and they are younger than 24 months of age, then they should be screened again after their second birthday. When an individual is screened for autism, if that screening indicates that that individual is at risk of having autism, then they will be referred to a speech therapist to undergo a comprehensive assessment. So this assessment might include a case history, medical evaluations, as well as the speech therapist's formal and informal assessment of that individual. So some of these might include informally an observation of the child. It also might include an interview, a language sample, other types of speech and language assessment, as well as there might be a feeding and swallowing assessment if that is needed. And an audiologist might also assess the individual to see if there are any hearing difficulties going on as well. In looking at treatments of autism spectrum disorder, it's really important to remember that there are many treatment options out there for therapists and for parents of children with autism. It's important to really find what would work best for that specific child, and trial and error can play a part in the treatment process as well. It's important to look at where the child falls on the autism spectrum and try to find the treatment that would be most effective for them. So I looked at a few of the treatments that ASHA posted on their website, and the first I came across was the Denver model. This is a one-on-one play-based treatment, and the child leads the play. And it can be done in one-on-one therapy. It can be done with peer interactions in school, and it could be used for home-based teaching. So they focus on the development of social skills. So they want to improve that child's social skills. The next I looked at was cognitive behavioral therapy. And this therapy integrates cognitive and behavioral principles to target desired behaviors. So kind of the understanding I came up with when looking at this treatment was that if the therapist is kind of able to change the way the individual thinks about things, that might lead to changes in their behavior. So it helps children to regulate their emotions and control their impulses that they might have. The third treatment I looked at was functional communication training, and this is a behavioral intervention program, and it helps to teach the child behaviors to exhibit that they might not have exhibited before in a challenging situation. So it helps to teach alternate behaviors. Parent-implemented treatment is becoming a lot more popular, and ASHA actually recognizes parent-mediated or parent-implemented intervention as an evidence-based treatment approach. So parents often do feel empowered when they become a part of their child's treatment plan. So if they're just sitting in the observation room of a clinic, they might not feel as an important part of the treatment plan as if they did serve as an active role in the treatment plan. This treatment approach can increase the learning opportunities for the child as they spend most of their time with their parents and not as much time if they were to see a therapist in a traditional in-person setting, because they might only see them a few hours a week versus the majority of the time they're spent with their parents. Parents can aid in their child's acquisition of skills as well as monitor his or her generalization of those skills, so they can be sure that the skills that their child is learning with them, that they also exhibit those skills in conversations with maybe their siblings or in just other settings, making sure that those skills are being generalized into other settings. The treatment I really looked into during this project was applied behavioral analysis. So this is an intensive behavioral intervention, and the clinician wants to see this client make improvements and make meaningful changes in their behavior and generalize those behaviors across many other settings, across many other different parts of their life. So this theory ties back to the behaviorist theory that we learned early on in the semester, developed by Skinner, that consists of reinforcing behavior to try to encourage positive behavior and suppress negative behavior. So in this treatment, the clinician will use learning strategies and use reinforcement to elicit a desired behavior and to encourage that behavior. Autism Speaks suggests that this treatment can help clients improve their language skills, communication skills, attention, social skills, along with their behavior and memory as well. And so this type of treatment can help improve many other areas that a child might be struggling in, and not just their behavior alone. So it can really help a lot of areas in a child's life. This treatment can be provided through direct teaching and naturalistic teaching in naturalistic settings. The intervention can be shaped based on the client's needs, interests, and their family, so this treatment is able to be very personalized for our client. Service providers of applied behavioral analysis can now deliver online parent training modules to parents of children with autism who might not have been able to have access to in-person services. So there are many advantages to this. I think that this is a wonderful opportunity for parents. The individual that the child spends the most time with can be trained to implement the intervention versus a therapist he or she might see a few hours a week. So earlier we talked about parent mediated intervention, and so this is one of those that the parents can do. This training empowers parents to take a part in their treatment plan. They're understanding the intervention process, and they're able to implement it on their own. So they do serve as the primary role of the intervention, and we see parents feeling empowered by that and feeling like they can help their child. The child diagnosed with autism will have access now to an evidence-based treatment approach that he or she might not have had access to before online training was an option for parents, which is wonderful because any type of intervention is better than none, and getting that intervention earlier rather than later is also a very important factor of intervention with individuals with autism. I provided you all with a YouTube link, and this really displays what ABA might look like in a clinical setting. So in this particular video, the clinician set up situations in which the client had to use verbal communication to receive the items he wanted from the shelf beside of him. So she really set up situations that gave him the opportunity to further describe the items he wanted off the shelf. So for example, one of the items they needed to play their game was a lid, and the client requested the lid. Well, the clinician grabbed the wrong lid off the shelf, and so that gave the child the opportunity to say, no, the big lid. So she knew what lid he needed. She wanted him to further describe it. So that gave an excellent opportunity for the child to communicate more with the clinician. Encouraging the child to remain seated during the exercise required that the child used his words to make a request to the clinician instead of grabbing the items off the shelf himself. So she would use positive reinforcement, like she would say, I like your sitting, or good sitting, Daniel, and this provided the client with positive reinforcement. This is an example of how advanced behavioral analysis might help this client to improve his language and communication skills. So he had to say what he wanted instead of just pointing at it and getting it himself. He also had to communicate with the clinician. So all of these things the clinician was setting up allowed him to demonstrate and work on his communication and language skills. And looking at what types of goals a child with autism might have, I listed 3 examples. So one of the goals that the child in the video we just watched might be working towards could be, in 6 months, the client will make verbal requests for desired items in 9 out of 10 situations. I listed 2 other goals, and these might be goals for any child with autism. The first being, in 6 months, the client will display proper turn-taking skills during conversation with the clinician in 4 out of 5 opportunities. And the second being, in 3 months, the client will increase his MLU to 3 when talking with the clinician for 20 minutes. So these goals are measurable and really target a specific behavior that individuals with autism might struggle with. I completed a SOAP note for the client in the video. So for the subjective portion of my SOAP note, I documented that the client is 3 years old. He has been diagnosed with autism. His mother reported that he has had his nap before our session, and that he came into the room eager to engage in the activities. So these are the behaviors I observed of my client. For the objective portion of my SOAP note, I documented the data that I recorded during that session. So the client made verbal requests for desired items in 6 out of 10 opportunities. The client displayed proper turn-taking skills during conversation with the clinician in 2 out of 5 times. And the client's MLU scored 2.0 while communicating with the clinician for 20 minutes. So that's the raw data. For the assessment portion of my SOAP note, I documented that the client increased the amount of times he used verbal requests from 3 out of 10 times from the last session to 6 out of 10 times. So he improved his score in that specific goal. The client also decreased his MLU from 2.5 at the previous session to 2.0. This potentially could be due to the client being distracted with toys in the room. Maybe there were less opportunities for the client to communicate with the clinician, resulting in a lower MLU. And I tried to explain maybe why he decreased from the last session. The client maintained his score of displaying proper turn-taking skills during conversation with the clinician when compared to the previous session. So again, he improved. Actually, in this goal, he stayed the same. So I tried during the assessment portion of the SOAP I tried to compare his data during this session with the data of the last session. And in the planned portion of my SOAP note, I just stated that we would continue the same treatment activities in the next session, targeting the client's language and communication skills. So I realized that the activities we did that session worked and the client did really well, and I plan to continue those activities during the next session. These are my references, so thank you all for watching my presentation, and I hope you all have a great rest of your semester.